Of course, it must have been really tough to live 1,000 years ago, but in some parts of the world it would have been very inspiring. The Greeks and the Romans were long gone, but Muslim scholars studied and added to the knowledge of great ancient thinkers like Aristotle and Hippocrates and Galen, and as a result established really sophisticated and successful centres of medical care. In places like Cairo and Baghdad and Damascus, hospitals were funded by the individual charity of men and women and by public money. And in spirit, they weren't a million miles from the highest tech hospitals of today. One 9th century hospital in Tunisia had waiting rooms for visitors, female nurses from Sudan, a mosque for patients and doctors whose skills included draining wounds and bone setting. In 9th century Baghdad, pharmacies used books on pharmacology as they prescribed drugs and herbal remedies. But they had to comply with strict health and safety laws enforced by a drug official. This knowledge directly affected the populations of the day, but it also had an impact on future generations, on us.
In 10th century Cordoba, there was this great surgeon called Abul Qasim al-Zahrawi, who has written a famous book which still is quite famous today, Al-Tashrif, which is effectively an encyclopedia of surgical tools. In it there are about 200 major surgical tools very clearly described.
These are toothed forceps which we can use to grab skin. Obviously the teeth aren't great for small blood vessels, they'll damage them. This little hook has a tiny hole in the top end of it, and if you imagine what we're trying to do is to hook underneath a blood vessel, the big changes have not been in the surgical instruments but in the survival rate after surgery because of antibiotics. And whenever you're breaking skin and having to hold tissue apart, the instruments are pretty similar.
The legacy of al-Zahrawi is, after 1,000 years, is still with us. We find the catgut being used by almost every surgeon around the world.
Surgeons that operate inside the tummy still use catgut to this day.
But what is really remarkable is that al-Zahrawi was not only first to use catgut in caesarean operations, first to design and use forceps during difficult labours, but also first to wire up loose teeth. And he even wrapped drugs up in catgut to make them easier to swallow, just like today's drug capsules.
Do you know who first discovered the pulmonary blood circulatory system?
No idea.
I think it's William Harvey.
A 16th century Englishman called William Harvey has always been credited with the identification of the pulmonary blood circulatory system. But the truth is, the discovery of the pulmonary blood circulatory system was in fact 300 years earlier by a Syrian physician called Ibn Nafis.
Do you know where vaccination was discovered?
No.
No idea.
By Edward Jenner, I think.
Another Muslim discovery, pretty systematically omitted from the medical books, is that of vaccination.
People think that vaccination, particularly smallpox vaccination, has been invented in the West. In fact, it was 300 years ago, commonly used by Turkish tribes. An English lady by the name of Lady Montagu. She went to Istanbul, and with a diplomatic mission she found that this was in practice and brought it back to London. It was in the beginning resisted by the church and by the establishment. 50 years later it was considered to be the discovery of the famous Jenner.
If you look at the story of medicine, it's clear how much we owe to one another. Medieval medical Arabic texts were translated into Latin, and that transformed the Western medical establishment. Muslim doctors were renowned for their skill and their nous. It's almost as if they were the doctors to the stars. Even Richard the Lionheart was treated by the personal physician of Saladin.